Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And you're joining Medicare Moments with your host, Toni King. Hi, Toni King.
How are you doing, Jim? We've got a very good question today because this happened about 2 weeks ago in my office.
Oh, wow. And we're going to bring it to our listeners. And we want to thank you for listening to our podcast, Medicare Moments, recognized as one of the top Medicare podcasts in the United States by feedspot.com. We thank them for that acknowledgement. And we want to keep on keeping on and adding listeners to Medicare Moments. So be sure to tell all your friends about this great podcast that Toni does every week for you to help you with all of your Medicare questions. So Toni, today you have a question from Spring, Texas, from Betsy in Spring, who writes, "Hello, Toni. I want to tell you and the Toni Says team, thank you for teaching us the value of Medicare Part B and for helping enroll my husband Mike and me in Medicare the correct way when he retired at 70 a few months ago. Mike was determined that we were going to go with Medicare Advantage PPO plans because it had $0 monthly premium, and there was no difference between a Medicare supplement and a PPO plan except the cost. Last week, Mike received a life-changing diagnosis, terminal liver cancer. Had we chosen the PPO route, then Mike and his medical team would not be in control of his care. Please let your readers know of our situation because your healthcare needs can change in a flash. Thanks, Betsy, Spring, Texas." And Toni, you did it again with great advice here.
When someone comes in the office and you're first getting on Medicare, Part B, it's gold. You need to treat it like it's gold. We teach when someone first gets on Part B, treat it like it's gold because it's valuable. Mike had retired in May. He had forms that he had to file with Social Security, and he got Part B. I explained to him how for 6 months he does not have to answer one health question. And he went with a Medicare supplement. And this is the honest to God truth. He's got liver cancer that's heading towards the heart. So if they had not picked the Medicare supplement, and they would have gone with the Medicare Advantage PPO plan, then their out-of-pocket could have been enormous, but they're in control now. They can go to MD Anderson. Out-of-pocket for her getting on a Medicare supplement is that Part B deductible, which this year is $226. They picked the Plan G, but that's not the important part. The important part is that they and the doctor are in control of the health care. If he needs to go anywhere nationwide, all he's got to do is pick up the phone and make a call.
And Toni, because of your great advice, he now has that freedom.
That's right. And we're here for him.
Right.
People need to realize that you only got one chance when you're first getting on Medicare. Because after 6 months on a Medicare supplement, you got to start answering health questions.
This appointment happened in your office and you saw it up close and personal, but you welcome people emailing you, you welcome people calling you, but it's really important because when you're looking at a $0 monthly premium, that looks really good on the surface, but you have to understand everything that goes with it and doesn't go with it, so that you make the best decision and customize your Medicare experience to your medical needs.
You go with the Medicare Advantage PPO plan. You have in-network cost and you have out-of-network cost. Here in the Houston area, in-network costs can be anywhere from $5,000 to $7,000. Out-of-network can be $11,000. You're paying a zero premium, but your out-of-pocket is enormous.
And you mentioned here that most people on a PPO plan never consider that they could have an out-of-network provider facility for their medical claim. But in current times, many healthcare providers are out-of-network with the nationwide Medicare Advantage PPO plan, correct?
That's right. We're not talking HMO. We're talking PPO.
So we're going to talk about the differences between Medicare Supplement and Medicare Advantage PPO plans right after we return from this all-important break. Don't go away.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And we are back with Medicare Moments with the one and only, aren't you glad we've got her, Toni King. Toni?
With an I and not a Y, because as you know, I am a girl.
Yes, I can say that's true because we've met more than once. And
I am a girl.
You are.
That's my tagline.
So Toni, what is a Medicare supplement? What's it all about?
Medicare got started July 30th, 1965. There was the Medicare supplement, and it works with your red, white, and blue card, with Part A and Part B of Medicare. It works with Medicare. Medicare pays its share, and your Medicare supplement picks up their share, the out-of-pocket costs. Which the Medicare supplement, you choose, the insurance plan will pay. It doesn't matter what hospital or doctor or skilled nursing facility, they just have to bill Medicare. So you and your healthcare providers are in control of your healthcare. You see that, Jim, when you go to the doctor, you don't have a glitch.
Correct. And it does give you a lot of freedom and comfort to think that way.
And it doesn't matter what state you're in. The only downside to the Medicare supplement is there is not that inexpensive prescription drug plan attached to it. You do have to get a standalone Medicare Part D plan. That's the only downside. The other downside is that the premiums go up a little bit each year.
Right.
My out-of-pocket is $226. My premium is very affordable. So people just need to personalize their Medicare. So that's the supplement. And with the Medicare Advantage PPO plan, you have to make sure that you live in that area 6 months out of the year. So if you're someone that's traveling around the country, you've got to make sure that you're somewhere 6 months out of the year. If you're traveling, you could really be in big trouble. A lot of people get their little wagons or their
RVs.
RVs, and they start traveling and having a good time. You've got to make sure you've got 6 months out of the year wherever you're living, because the Medicare Advantage plans are zip code rated wherever you're living.
Okay.
That's what they go by.
An important tip from Toni. That's how your plans are rated, based on your zip code.
And you want to make sure that your doctors and everybody are in network. If they're out of network, you could pay more. You do not use your Medicare card. You use that insurance company's card. Medicare pays that insurance company each month for your care. That's where they have to get all the claims out of. So the more people they get, the more money they make, it just grows.
Okay. And Medicare Advantage plans during open enrollment especially, they're reaching out all over the place to get people to sign up. I mean, there's a lot of mail that comes to your mailbox. There are a lot of phone calls that come directly to your cell phone. Correct, Toni?
Or to your email. From October 15th through December 7th is Medicare's annual enrollment period.
Right.
Medicare's open enrollment is from January through March 31st, where if you pick the wrong Medicare Advantage plan, you can change. That's all that's about.
Right. And one of the other things that have attracted boomers, and I know this because I hear people talking, and you mention it here in this article, is the gym memberships and also dental and vision. And people look at that as an upside. And in some ways, it is an upside.
It is. But your gym membership's not going to pay your cancer claim.
Correct.
And dental and vision, a lot of doctors don't accept that. Depends on who your dentist is. A lot of dentists do not like dental plans. I mean, it just depends. You've got to customize. You can't get something for nothing.
And you've said this before, Toni, and I think it needs to be pointed out again that when you get that call or that email or that letter from someone pitching you their Medicare plan, that's sales. It's not necessarily what you need. It's someone just telling you what they want to sell you versus customizing your Medicare plan for your special needs.
And they're the nicest people on the phone. They know exactly what to do to get you where they want to go.
We want to get you where you need to go. And that's why Toni has her Medicare hotline. It's right there. Write this down. 832-519-8664. 832-519-8664. Toni, as she said earlier, is Toni with an I, and you can write her anytime. info@tonisays.com. That's info@tonisays.com. She welcomes all of your questions, and she'll get back to you with a phone call. They'll get back to you with an email. And understand that there are certain times of the year, especially during the annual enrollment period, where it gets busy, so it takes a little bit of time to get back. But she wants to make sure that you have the best base of knowledge as you move forward. And that's why she's ever expanding tonisays.com, where you're going to be able to go there and see video presentations that will really help you as you try to navigate the tricky questions and the tricky enrollment into Medicare.
Because with Medicare, it's what you don't know that will hurt you. Not one day, but for the rest of your life. That's what's sad.
Well, thank you for joining us for Medicare Moments. It's been our pleasure to be with you, Toni.
Thanks, Jim, for making today fun. And let's just go and relax because it's fixing to get busy, busy, busy.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sebesta here, host of Retire Repurposed. Now, this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.